Hi, I'm Elsa Luff. I will discuss Unit 8, Rules and Responsibilities of the Registered Nurse. Contents. What is a registered nurse? How to become a nurse. Entry requirements. Fields of nursing. NNC. Nursing and Midwifery Council. RCN, Royal College of Nursing. MDT, Multidisciplinary Team. Effective communication and recent changes impact the rules and responsibilities of the registered nurse. Registered nurse precedes the role of a leader, caregiver, and clinician who uses clinical conclusions and is responsible for providing care that enables people to maintain, improve, and recover their health as well as coping with ongoing health person's life. Providing the best quality of life and care whatever illnesses or incapacity. Registered nurse advocate patient, challenging discernment and poor practice, maintain their skills, knowledge, practice, and retain a good personal development. Registered nurse must be transparent about the care they provide and work within their proficiency and ask for assistance if needed. They must complete promptly training for new roles and comply with legislation guidelines that protect, alleviate harm, collaborate in audits, investigation, as well as complaints made against them. Furthermore, provide leadership aiming to improve the service healthcare experience. Entry requirements. Nursing education in the past has varied significantly. It was shorter. There were penalties for those who did not complete their courses, and all were under the control of matron. In contrast now, nursing education depends on the individual university entry criteria, which includes A levels or equivalent qualifications such as Level 3 QCF, GCSEs in English, Mathematics, and Science, specifically in biology and human biology. The APA postgraduate program, accreditation of prior experiential learning, enables you to do a postgraduate course in 2 years rather than 3 years. The traineeship is a combination of schooling and preparation that will aid to find job or apprenticeship. It has 3 core elements: work, location, exercise, supporting in English and mathematics if needed. NHS apprenticeship. The cadet program includes supervised experience in a range of diverse settings and can lead to level 2 or 3 qualifications. This can be with or without service user contact. In contrast, apprenticeship combined with working and education builds a foundation of knowledge, work, experience, and interaction with service users. This nursing degree pathway has a duration of 3 to 5 years depending on permitted reasons, and will offer health and social care workers permanently employment in NHS. Fields of nursing. There are 4 fields to choose to become a registered nurse. They are adult, children, learning disability, and mental health. Adult nurses collaborate with patients who are 18 years of age and above. They often work in hospitals, community health centers, or nursing homes. Patients may suffer from one or more long or short-term physical health conditions, such as injuries from accident, heart disease, pneumonia, diabetes, or cancer. They can specialize such as practice nursing, health visiting, practitioner, emergency unit, or critical care. Children nurses works with children up to 18 years of age, often in hospitals, within the community, in school or infant adolescent services. They can specialize in areas such as safeguarding children in school or health visiting. Learning disability nurses help with special needs, making their lives fulfilling, and help people to live independently in community or in hospitals. They can develop in areas such as sensory impairment or managing epilepsy. Mental health nurses support individuals with mental health needs to build their communication skills in specialist hospital or in community secure service settings, and can develop in areas such as camps and adolescent mental health services. NMC, an independent regulatory board that regulates nurses and midwives across the country, and nursing associates in England. NMC promotes higher education, maintenance of the register of professionals qualified to practice and support their professions, and the public. The Code of Conduct outlined that midwives and registered nurses must uphold their registration to practice in UK. There are four themes of NMC Code set out in 2015. They are primarily prioritize people, secondly, effective practice, thirdly, preserving safety, and finally, promoting professionalism and trust. By upholding the standards, registered nurses are required to be accountable and honest for their actions. They must maintain confidentiality and privacy and communicate effectively. Registered nurses must work independently as well as in collaboration with others to promote patients' well-being and self-government. Royal College of Nursing, or RCN, is described as the world's main union group of professional bodies and organizations outlined in nursing health policies. In addition, RCN acts on behalf of nurses. It supports them and influences them to develop and maintain their skills as well as promoting high quality nursing. MDT, or Multidisciplinary Team, is a group of professionals such as GPs, doctors, health visitors, social workers, physiotherapists, pharmacists, and other agencies who work together aiming to deliver person-centered and a holistic, integrated, and coordinated care for the best outcome and in the best interest for the service user. A multidisciplinary approach results in greater patient satisfaction in relation to their treatment better performance, and can lead to a reduction in the duration of inpatient care and decrease in the number of spontaneous hospital readmission. Effective communication. Types of communication. Verbal. It helps to establish an eye contact to the face of the receiver at your level, to form an open posture, to be professional, respectful, and to have a caring attitude. It is important to establish a person's preferred name and call the person by their preferred name. This shows as a respectful and personal approach. Give the person with whom you are communicating space to ask questions and check to see if they have fully understood the conversation by asking questions yourself. Non-verbal communication uses body language to convey confidence, credibility, sympathy, understanding, and reassurance. Written communication required to record personal information such as medical information, issuing prescriptions, referral, letters, emails, and text messages for reminding people of hospital, doctor, dentist appointment. Formal communication requires precise levels of accuracy and consistency, especially when communicating complex topics, such as treatment or diagnosis. Effective communication must be clear, accurate, consistent, transparent, accessible, and inclusive. Patient safety is the key, and poor communication can lead to patient risk, loss of trust in the health and social care system, as well as legal action, firing, and disciplinary action. Recent changes and their impact to the roles and responsibilities of the registered nurse, political, social, economic, organizational, policy, technology and scientific, gender, and COVID-19. Political changes. The NHS Act 1946 had a deep impact on the roles and responsibilities of registered nurse and allied healthcare services at that moment. And since 1948, government strategies and health services have given more responsibility to the service user, encouraging them to take responsibility for their own health. Subsequently, these changes resulted in registered nurses and other health professionals to become more responsible for their own decisions and actions. Registered nurses also encouraging society by supplying information as well as helping them to change. They promote help and advice on personal attitudes, behavior, and simply self-governing living and health choices. Social changes. Social changes in healthcare increase the pressure on service user and funding, and because of the increasing cost of caring for vulnerable and chronic ill patients, innovative approaches to care and clinical guidelines and protocols. Patients' pathway have made medical information more comprehensible. Patients are able to interact with nursing decisions. Technology and scientific. NHS are hoping to reshape medical and healthcare technological innovations. For instance, registered nurses are using computerized care planning, which is better organized. New diagnostic, analytical, and screening processes are resulting in timely improvements for better health. Other staff and registered nurses are required to train in the latest technological innovations as well as coping with any principal's dilemmas that may occur. Gender. The effect of male nurses cannot be fully unspoken without attention to gender inequalities and the specific socioeconomic setting in which they accept requires for a gender-centered approach globally to nursing recruitment policy that consider not only on the impact on developing countries but also of the well-being of the immigrant nurses themselves. Economic changes. Registered nurse and frontline healthcare workers felt the impact of economic changes, such as inflation, increasing demand from the public, in cost technological development, problem with supplies, and the general aging population. In 2016, UK government announced an increase of 1% cap on NHS pay. This had a negative impact on registered nurses. However, the RCN movement to abolish the cap in resulted in the health secretary announcing in 2017 that the 1% cap had indeed been scrapped. Policy. Expanding and using research-based direct approaches to managing service user safety, such as pulse risk assessment tool, and increased awareness and protecting patients from harm. Organizational changes. Clinical commissioning groups, or CCGs, are accountable for the commissioning health within the community, hospital, and health services in the local area, and their care mental and learning disability support, and more planned hospital services. Registered nurses play key roles in clinical commissioning groups, working largely to achieve better health outcomes for local populations. Using the open communication method and better leadership for high-quality care resulted in safer, more empathetic health environments. COVID-19 has increased in workload, burnout, and stress nurses, all affecting both the public and clinical staff, and PPE issues. Conclusion. This research has helped me to understand the weight of responsibility on the registered nurse to abide by the legislative rules by doing. So the registered nurse is working towards the best result and the best interest of the service users they are working with. I have been able to appreciate that nursing goes hand in hand with politics and economics, and that other organizations will forever be involved in shaping the role of the registered nurse. Registered nurses are expected to keep up to date with innovative medical treatments and medicines, as well as modern technologies that relate their works. The registered nurse boundaries when accessing social media. The Royal College of Nursing is the voice for and act on behalf of all nurses, and the Nursing Midwifery Council regulates the healthcare staff to work together. Working in a multidisciplinary team ensures that everyone is working in the best interest towards positive outcome for the patients. Recommendation. I recommend reading the question clearly and fully understand the criteria that is being asked. I recommend establishing the facts and all information gathered from various sources available from Learn Direct, online and offline. I recommend seeking advice from the assessor and asking someone to read over the finished draft to use separate notes for referencing and save all duplicate work.